You're watching The Wellness Hour, the leader in medical news and information. I'm Randy Alvarez. Today's topic, a new treatment option for people with gum disease. No more bleeding gums, puffy gums, loose teeth. With us, we have an expert on the topic. He's Philadelphia's periodontist, Dr. Stephen Brown. Dr. Brown, welcome to the program.
Well, thanks for having me back, Randy.
Now, we had you on the program. I guess a lot of people know you as the doctor that specializes in dental implants. And we say no more dentures. Well, now we're talking about no more bleeding gums, puffy gums, using a laser.
Indeed.
Now I have a lot of questions, by the way. But before we get started, for people that don't know you, who is the typical patient and what are the different procedures you do? Where's your practice?
My practice is in Philadelphia. And in my practice, we treat basically two types of patients. Patients who've lost teeth and want to replace them with dental implants, which of course is a modern miracle, and people who have periodontal disease and are looking for alternatives to the traditional methods of treating periodontal disease.
Okay, gum disease, by the way. I guess it's the number one way people lose their teeth.
It is
What is it? What is it?
It is absolutely the number one cause of tooth loss in the world.
Okay.
Donna Shalala, who was the Secretary of Health and Human Services, did some research, and in her research she showed that 70 to 80% of all adults have periodontal disease. And they speculated based on their data that more than 50% of those have advanced, moderate to advanced periodontal disease.
So what is it?
Periodontal disease is simply a bacterial infection. It's a bacterial infection of the gums, which when it affects the gums is also affecting the whole body. And what we've learned today, what's really astounding, is the fact that periodontal disease has an effect on many life-threatening diseases such as cardiovascular disease, stroke, diabetes, and a host of other.
So it's a bacterial infection. You know, we talked on the phone. Okay.
Yep,
and I've been trying to get you out here to talk about this for quite some, at least a year, right?
Indeed.
You say we treat it as a bacterial infection because that's what it is.
It is
under the
indeed.
gum line, so I understand this correctly.
That's correct.
And there's two ways to get rid of it.
There are essentially two ways to get rid of it. Yes, actually there are two ways to get rid of it, but what's more important is that we talk about the fact that it's under the gum. But literally it's breaking through the gum and into the bloodstream, in which case it is causing an infection that is coursing through the entire body.
Okay.
This is absolutely robbing people of their vitality. It's causing them to have less energy. And until it's reversed, the patients often don't even know. I mean, I can tell you a story about one patient who I had who literally said she was lethargic. Once she'd been treated adequately, once she'd been treated and we got rid of the bacteria, she felt like a new person. She went back to jogging again.
That's interesting.
And she's a new person.
So bleeding gums, though. So a little bit of blood is okay or not okay?
No blood is okay. You wouldn't accept blood from anywhere else in your body. In fact, if you had bleeding nose or bleeding from your eyes or ears, you would dash off to the physician very quickly. We don't accept any bleeding as being normal. If you are bleeding, you have an infection. That is the response, the inflammatory response to that infection.
So let's begin with the treatment of gum disease. How has it changed over the last 20 years, 30 years, as compared to today?
Gum disease, when you have a bacterial infection, causes a crevice or a pocket between the gum and the tooth. Okay. This is a warm, dark, moist area filled with food, perfect area for bacteria to grow. But it's very difficult to clean. So the conventional method of treatment was, how do we get rid of this pocket so as to make it easier for the patient to clean? So if this was the pocket, the only way to get rid of it was either to cut it off or move it down. What does that do? Well, it gets rid of the pocket, but what it also does is it leaves the patient slightly disfigured. You have long, sensitive teeth. You've got teeth with spaces between them.
But that's how it's being done every day today. Is that right?
As we're speaking here, it's being done in thousands of offices across the country.
And that's now, cutting it out, cutting out this infection.
Cutting it off or cutting it out, one or the other, however you wish to say it. The fact of the matter is, there's nothing intrinsically wrong with the idea of doing surgery, but there's a much better way because the surgery is treating the effects. It's not treating the cause.
And the cause is a bacterial?
The cause is bacteria.
Okay.
Never forget the fact that the bacteria are the cause, and that is the reason why the laser gives us options that we never had with the more traditional, I like to say, antiquated therapy.
And now when you talk to doctors about this, because I guess in your field you are the gum specialist, the periodontist, right? Is that right? It's divided, right? Some say, you know, because I've anticipating this interview, some of the periodontists say, Randy, I'm not ready yet. I'm not ready to do it. I don't know if there's enough evidence. I don't know if it works, they say.
We're heavily divided. Okay?
So does it work? Let's start there. It works.
It absolutely works. First of all, not only does it work, and I can talk to you about the clinical results, but it works because we have research evidence published in refereed journals read across the world that say that this works. So there no longer can be any doubt that it works. Someone could have a different point of view.
Do you do surgeries anymore? For pocketing, for
I'm going to give you a statistic that's probably going to knock your socks off, okay? In the last almost 2 years, I have not done one flap surgery, and flap surgery is the traditional surgery.
For gum disease?
Flap surgery for the sole purpose of eliminating pockets.
A pocket.
I haven't done it once in the last 18 months to 2 years.
There's
a reason for that.
So you just use the laser?
I use the laser. I use the laser routinely for a number of reasons. Most important of which is it attacks the cause. It attacks the bacteria. The fact of the matter is that laser energy, light energy, all it is light, has a fantastic ability to be attracted to colors. And the fact of the matter is that the bacteria that cause periodontal disease have 4 colors: red, yellow, orange, and black. And so the laser energy goes right through the tissue, deep into the tissue, kills the bacteria with no collateral damage to the other tissue. So it's safe, it's effective, it causes the bacteria to be killed on the spot. Consequently, when we get rid of this bacterial activity, the patient's own ability to heal takes over. And we don't have any of those side effects that I spoke of before.
Now, what about pain? When you compare the two pain-wise, I mean, what do patients say? Because you got the laser therapy, and then you have the traditional cutting and stitching.
Once again, absolutely no comparison.
Really?
The routine for me over the past 25 years or so, first of all, I've been teaching this. I still continue to teach surgery because one needs to learn the basics. But over the past 25 years, it was routine for me to prescribe narcotic analgesics for patients. Sometimes they had swelling and discomfort for a number of days.
With traditional surgery?
With traditional surgery.
Gum surgery, okay.
If we were doing it in more than one area of the mouth, they didn't want to come back and have it done again. So we went to doing it full mouth, which made it even worse for many people.
Very painful.
Yes.
So the laser?
This is entirely different. Entirely different.
Okay.
I have patients, I call all my patients the night after their surgery. Routinely, they're telling me, oh yeah, I took a couple of Tylenol. Yeah, one tells me I had some Advil. That's the most, and they're done by the next morning.
So you just go around with a laser, zap it out. I don't want to oversimplify it, but you're like killing the bacteria.
That's right.
And the bad breath goes away.
In fact,
is that right?
Sure.
Have you heard that happen?
We've addressed the cause.
Where the next day they say my breath is better?
Let me tell you a story, okay? I had a young teacher who came to me, and she was in tears. 2 days before, one of her little third graders was talking to her, and she said, Miss Jones, you have poopy breath. She was so upset by that, and she spoke to a friend of hers who happened to be a patient. She came in, we diagnosed her, we treated her. The bad breath is gone completely. She's a new person.
So it's a bacterial infection. And I'm sorry, I keep asking the same question, but so by killing this infection, the breath gets better.
Exactly. We've taken away the cause of the bad breath. Get rid of the bacteria, you get rid of the disease, you allow the body to take over. Get rid of the bacteria, get rid of the volatile sulfur compounds, the gases that are causing bad breath. Many, many people who have the problem maybe know they have something, but they don't know the extent. Maybe they've had some minor treatment from their dentist, but they've never gotten to a periodontist. They don't know, because this is a silent disease. You don't know the symptoms. The bleeding goes away after a while, and until you start having pain or teeth falling out or teeth separating.
So when
then
teeth fall out, that's
late.
because of gum disease, you're saying?
Indeed.
Okay.
The vast majority of teeth are lost because they no longer can be held in the mouth. The bone that supports them, the supporting bone, is gone.
Then tell me this. Okay, so, and I mentioned that I've had you on the show to talk about dental implants. And at that time we said there's like 20 million people have either upper or lower denture. Okay. Of all of those people, so they lost their teeth because of gum disease in most cases.
Right.
How many do you think, if treated early with the laser therapy to kill this infection, could you have eliminated?
I like to think of this as a public health problem. I mean, the truth
Do you
is,
think you could have 50%, 80% if you got them early?
if we got them early, maybe even more than 50%. Now, granted, some people broke a tooth off and they lost it. Some people got severe decay and they lost the tooth. But the vast majority have lost them due to periodontal disease. We could make an enormous impact, an enormous public health impact, if we could simply get to these people early enough.
You know, we've talked, and you say it's more than just getting rid of gum disease and the bleeding gums and the bad breath, but it's a lifestyle thing. It's about self-esteem. Elaborate on that. Because you say you see transformations in your practice.
I see transformations all the time. I see people who were feeling ill. They were tired. Their immune system was broken down. They weren't dating because they had bad breath. They knew they had this kind of a problem. They stayed out of the public eye. You retire when you don't have a good smile, when you don't feel good about yourself. Fix the problem and you change the person.
Good.
Fix the problem and the person comes out of the shell. And I want to tell you, that is what really gets me up in the morning. That
You love
is
it.
what's reward.
You love this.
I wouldn't be doing it as long as I have and teaching as much as I do and spreading the gospel, and I hate to use that terminology, but that's what I'm doing. Spreading the gospel of a technology that's available today to everyone that is without comparison.
I see you guys wear, not you in particular, but this buttons, and you have like a picture of, it says no more cutting and no more stitching or something like that.
The logo of Millennium Dental Technologies, and by the way, it's important to know that not all lasers were created equal. Physics is different. There is only one laser that is FDA approved and a patented protocol for treating periodontal disease. And the only one is the PerioLase laser. That's the only one that has been approved. That's the only one that's been researched. That's the only one that will do the kinds of things that I've been talking about. There are many different lasers that will do many different things, some of them destructive. Those are not the ones we want to be using. So you go and you want to ask, does my periodontist have a laser? And if he has the laser, make certain that they've got the PerioLase laser, because it's the only one that has university-based studies proving that it works.
We're going to take a quick break. We come back, more about the process, because you do something, I guess, that's very unique, where you actually show the patients what's going on, the bacteria under their gum line.
Exactly.
You're watching The Wellness Hour. I'm Randy Alvarez. We'll be right back. You're watching The Wellness Hour, leader in medical news and information. I'm Randy Alvarez. A new breakthrough in the treatment of gum disease. With us, we have Philadelphia's periodontist, Dr. Stephen Brown. Dr. Brown. Okay, so there's the surgical method to get rid of gum disease.
Let me show you about that.
Yeah, let's take a look. You brought some photos.
So this shows cutting the gum and pulling the gum away from the tooth. Essentially, you can see a scalpel cutting that gum.
So this is how it's being done
This is how it's being done in thousands of offices while we're speaking.
So they're cutting out what?
They're cutting out the diseased tissue.
Okay.
And in fact, there's nothing wrong with that. The problem is that technique, after it's done, leaves a patient looking like this.
Okay.
Spaces between their teeth, black triangles between their teeth, separations between their teeth.
Because they're cutting out the gum.
Because they're cutting away natural tissue rather than doing something that'll cause that tissue to heal.
Like?
The laser. The laser will kill the bacteria. The laser will allow the tissue to reconstitute itself. It'll allow the body to do its best thing, heal itself.
Interesting. How long does it last, by the way?
This has been being done for more than 10, 12, 14 years at this point.
Okay.
And it looks from the research that's been done that this is very long lasting. Would I say you could never have a recurrence of some of the gum disease in parts of your mouth? It's possible. We don't know that yet. But what we do know is that the results post-operatively aren't even close to what the old results were. They're that much better.
And it doesn't hurt. I mean, patients don't really complain about the pain.
They do not complain about the pain. We use local anesthetic when the procedure is being done. The laser fires at a very high frequency, so the nerve endings are not being attacked.
Okay, so day one. Take me to that day one.
Well, what we do in our office is a little bit unique. We recognize the fact that this is a disease that's caused by bacteria. I want the patient to get a sense of that. For years, I talked to people about bacteria and plaque. They thought plaque was one of those things they hang on the wall that they give you after giving a lecture.
All right.
But in fact, I wanted them to see that it was the real McCoy, that it was real, that they really had germs. So what we do is we take a little sample of material from under their gums, completely painlessly. We put it on a slide and under a microscope. What better way to look at bacteria?
Okay, we have a slide. We have a little video of
You
that.
have a little video.
Okay, so with that video. So that's what they see?
That's what they see, and this is the response, okay? Most people's mothers told them the germs were bad. They didn't want to have infection. The first thought, the first thing they say is, you mean those things are in my mouth? Intrinsic in that statement is, I want to get rid of these things, and I want to get rid of them as fast as possible. A phase contrast microscope allows us to make this real, and I'll tell you something else. When they come back at later visits or on recall after their treatment, they want me to take a slide because it acts like a scorecard. They want to know how they are.
Do you give them a score?
They literally have a score, yes. And the patient wants to know that they're doing well. And they can look at the screen. They don't need me to give them a scorecard per se. They know because they've been educated.
And they feel better. What about hot and cold sensitivity that's caused by gum disease? Does that go away pretty fast?
The hot and cold sensitivity that's caused by gum disease is caused by recession.
Okay.
When you get below the enamel of the crown of the tooth, the top of the tooth, the root is not, protected very well. It's like running around in cold weather with a wet t-shirt.
Okay.
Okay? The sensitivity of the teeth is because of the position of the gum. With the laser treatment, the gums don't recede. They stay where they are. The disease tissue is removed, the bacteria are removed from the inside out.
Okay, we have a video of how this works. We're talking about gum disease today. So this video, this animation, we're going to play the animation and then we'll talk about it right after this. We're going to go to this animation. This is the laser actually working in the mouth animation.
Exactly.
This is the video animation of the FDA-cleared periodontal procedure called lanap, an acronym for Laser-Assisted New Attachment Procedure. The fiber optic tip is gently placed at the top of the periodontal pocket to begin removal of diseased tissue that lines the pocket. This is where bacteria live and build a neighborhood of its own that destroys healthy gum tissue and bone that holds your teeth in their proper position. There are specific germs and bacteria that cause gum disease. The periolase laser is designed to target and eliminate selectively only the diseased tissue and germs, dissolving toxins and leaving the healthy tissue unharmed. The laser tip is then removed from the pocket and set aside. In the next step of the procedure, ultrasonic cleaners as small as a laser fiber tip are used to remove the hard deposits we call tartar or calculus from the top of the teeth and roots. These instruments use sound waves to vibrate and break apart the hard mineral calcium deposits, with water flushing away the debris and cooling the instrument tip. Some hand cleaning instruments may be used at this time to remove any remaining hard calcium deposits. Then the laser is used again at the bottom of the pocket to remove any remaining diseased tissue. This pass of the laser also sterilizes the tissue and bone and completely eliminates the bad bacteria, germs, and toxins. It also stimulates the formation of a blood clot, which once formed contains fibers that reattach your tissue to the tooth surface and seal out debris and bacteria like stitches would, and creates the right environment to cause the bone and other soft tissues lost from the disease to grow back.
So that's
exactly how it works. And what you saw there was a laser, a fiber optic cable that is less than 3 human hairs, 0.3 millimeters to be exact. It slips up under the gum very easily.
We have a photo of that instrument. So you hold this in your hand.
Hold it in the hand, and the fiber optic tip goes under the gum very easily, very simply. It's smooth, and then we just use the laser energy to get at the bacteria. In conventional surgery, we're using big instruments that you literally have to pull the gum away from the tooth in order to get to where the action is.
What about expense? I mean, is it less expensive or about the same as traditional?
It is about the same as traditional surgery, or it may even be a little less. But one thing is for sure, it's cost effective.
Does it work better, in your opinion?
It works much better in my.
So if you were speaking to 1,000 periodontists right now, or general dentists, or oral surgeons, or whoever, and they said, Dr. Brown, does this laser therapy work? Better, more effective, in your opinion, than traditional cutting? And
better, effective, less invasive, and predictable.
Well, good. So what do they do? Now, by the way, somebody watching this, okay, so they want to, and their symptoms start going away right away or over time?
Their symptoms will start going away within a day or two of having the initial laser treatment done. It takes some time before, and the treatment goes on beyond the one shot of the laser. First of all, there are 2 visits with the laser, and then they see.
So you're big on at-home care, though. So after they've lasered, then you give them a protocol.
Yes, and the protocol we give them is the use of the water pick, the water irrigating device. People like that. They use warm water in it with an antiseptic. The idea is to kill now the bacteria that are on the tooth surface before they turn into the bad bacteria, the ones associated with disease that cause these pockets. So once you've gotten the disease under control, what you want to do is on a daily basis, kill the bacteria. I can't understand why 100 years later, we're still using string and bristles to treat an infection.
Let me get this straight. Okay, so traditional therapy. Okay, so they have bleeding gums, bad breath, puffy gums, receded gums. So they go in and they do a surgical procedure to cut it out. We're talking about you go around the mouth with a laser, kill the bacteria.
Yes.
Okay. You're saying that in a majority of these cases, in traditional surgery, do they always give antibiotics? And
No.
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 Okay.
No.
But you rarely give antibiotics.
I rarely give antibiotics.
So it's like a holistic approach in a way.
It is
a lot of
very
people are
much.
afraid of antibiotics.
It is very much a holistic approach, and we don't want to cause patients to get sensitivity to antibiotics by giving it to them too much. The fact of the matter is, the laser is killing the bacteria. We don't need the antibiotic to kill it.
Is this the future of dentistry?
It is absolutely.
How many years before you get rid of the old way?
Well, I don't know how long it's going to take.
50 years?
I hope it's a lot faster than that. But the fact of the matter is, everything in medicine is going towards non-invasive techniques. Okay? All of the surgery, arthroscopic surgery, back surgery, knee surgery, it's all being done with non-invasive techniques. Why shouldn't periodontal disease be treated the same way? This is, in fact, the 21st century. It's time that we got on board and understood that this is an infection and ought to be treated like an infection. And when you do, the good old body takes over with its healing potential, and the rest is, as they say.
What could the critics say? I'm no expert on the topic. What could they say? What could they argue with what we've talked about today when it comes to the laser killing this bacteria?
Well, there are some critics, particularly some of my colleagues, who say, oh, there are not enough studies. Well, I don't know how many studies you need before you can adapt a new technology. The fact of the matter is, before long, the patients are going to be demanding this kind of treatment, just like they demand other sorts of treatment that have come down the pike. People find out about this, and as they do, people like you are helping them to find out about this.
And knowing what you know now, you can't do it any other way. You can't go back to the cutting and the surgery and removing gums and gum tissue.
For routine periodontal disease with pockets, I'm not saying I never do surgery. I do surgery when I place implants. But the fact of the matter is, I would never turn back. There's no reason to turn back.
Are you like sanitizing the mouth? I'm trying to, with the laser in a way?
In a manner of speaking, you're sanitizing the pockets.
And the pocket is the space around the teeth.
You're doing more than sanitizing them. You're rendering the bacteria dead. They're killed. So yes, the pocket is aseptic.
Logically, it makes sense. So give me a rundown of the symptoms of people that are watching this, when they should come in. When should they come in?
The minute you know you have any bleeding gums, the minute you know you have any bad breath, the minute you see any recession on your teeth, the minute
That's not just from brushing. That could be gum disease.
If you're brushing and it's bleeding, it's because you have gum disease.
Okay.
You don't bleed if you don't have inflammation. You don't have inflammation if the bacteria are not irritating the gum, in a manner of speaking, and causing an immune response, which brings in the cells that cause bleeding. So if you have any bleeding, if you have any tender sore gums, if you have recession, sensitivity, if you got spacing between your teeth, if your bite doesn't feel right, if your teeth are moving, if your dentures don't fit well anymore, partial dentures, all of those things are signs of periodontal disease. And yes, run, don't walk. And ask,
good for you.
And ask first, do they have a laser?
In our green room, you said that they've said, how come, I've never heard of this before.
The problem is that it is different than the traditional way in which we've been taught. So consequently, there aren't a lot of people out there who are willing to put their head up out of the foxhole and say, listen, we're doing this, it works. Because the vast majority are not yet doing it.
And they can go back to smiling again.
They can go
better
back to smiling
confidence, everything else.
You bet.
I want to thank you for coming on the show. Great info, great
Thanks.
stuff. You've been watching The Wellness Hour, leader in medical news and information. I'm Randy Alvarez. If you'd like to see this again online on our website, you can put in Dr. Stephen Brown or Dr. Brown, you'll find him there, or laser dentistry or gum disease, you'll find it there. And for those of you that are on Twitter and would like to comment about what Dr. Brown had to say today, you just put pound Wellness Hour. For now, I wish you good health.
Thanks for watching The Wellness Hour, the leader in medical news with your host, Randy Alvarez, the authority on health issues.